Welcome to another Class 4 laser video with Kalon Prinsky, 20-year laser specialist. I've been working with a large variety of therapeutic lasers over the last 20 years. And today I'm going to be sharing with you about the Remy lasers. The Remy Class 4 lasers have been around for about 5 years and they are really fantastic. I'm going to be sharing with you the Remy Quad 27 watt 4-wave Class 4 laser. Which is a very nice, compact, 4.6 pounds, lightweight, it's portable. It has a 7.2-inch full-color touch screen. It's got multiple screens to allow you many different benefits and features to easily take advantage of. It's quite intuitive, easy to use, and best of all, it's extremely effective. So now we're going to be sharing with you about the Remy Quad Class 4 laser, a 4-wavelength Class 4 laser system. With this screen here, you can see we have the option of human protocols, animal protocols, and in the future we intend to have hands-free protocols as well. So let's get right to the human protocols. As you can see here, this is the body site selection screen where you can see all of the different parts of the body that you could choose from to treat. Each protocol has been rigorously tested and put together by a team of Class 4 laser treatment specialists, and so that you can see what the screen looks like. We'll just go ahead, choose shoulder, and choose next. And on this screen, we get to choose over here the skin color, which and the body size. So first of all, we want to choose the body size from large, a medium, or small. Say we're working on a medium person with dark skin, then those two would be checked off. This graph has to do with the chronicity and the pain level. So from low, mid to high, or acute, moderate to chronic, you choose which level, and then you simply, to treat, go ahead and press the treatment, and now we can see the protocol. It says right here, treatment for shoulder, medium, body size, dark skin, moderate to middle pain. And you can see that it has an average power of 16.7 watts and that there are 4 different wavelengths and powers distributed throughout those wavelengths. And this says CW for continuous wave. Over here, we can see the amount of time and the phase energy and total energy, total joules delivered within that treatment. For this shoulder treatment at 16.7 watts, the total treatment time would be 2 minutes and 59 seconds. At this point, you simply push standby, and when it makes that sound, you know that it is ready. The ready button turns green, and we simply remove the handpiece from the handy-dandy placeholder in the back. There's a little clip there that holds it in place. And just so that you understand how portable this laser is, there's actually a built-in handle right here, and you can lift it. It's only 4.6 pounds, so it's easy to move around, and it's easy to store the handpiece in the back. The cord actually wraps around. There's a track inside that allows you to wrap the cord, the 400 micron fiber cord, around for safekeeping if you need to store or travel. And this red color is the aiming beam, so it's not producing really any heat, and it's not dangerous for the eyes or anything like that. I wouldn't necessarily shine it at an open eye, but just so you know, this is telling you it's ready, and it hasn't been activated until you push this yellow button here on the back of the handpiece. Once we turn this yellow button on, like, we need to make sure that our safety glasses are on, and then we push the button, and immediately it starts to make the sound. The sound tells you that the laser is on. One of the things I really love about this quad laser, the distribution of the power throughout the different wavelengths, is it doesn't get too hot. It's comfortably warm. Your patient's going to definitely know that it is on and it is acting and it's serving up those photons to the cells, but it is extremely safe and comfortable to operate. As you can see on the screen, it's counting down. Each beep counts down. It lets you know that it is in operation, and so you and your patient will know that the laser is working, and once it is completed, that protocol session, it will stop beeping. If you need to turn it off, you can just push that yellow button again, and it's instantly back in standby mode. So it's important to remember that every time you start your laser, you want to make sure everybody in the room are wearing their protective glasses. We've got the protocol set up for the lumbar spine. We're just going to go ahead and do some demonstration, share how to use it on different parts of the body. Here we're going to go ahead and press next. We're going to choose for Sarah. Her body size is medium. It's set for darker skin and a chronicity of moderate pain level. And we're going to go ahead and push treat. It opens up the screen for 25.1 watts of combined power between the 4 different wavelengths. And we just go ahead and push standby. Once it makes that sound, we know that it's ready. It shows ready here with the green button. We've got the yellow button on the emitter. We push the yellow button, it turns the laser on. You hear the sound. It tells you that it is live, that it's active. Everybody in the room should be wearing their glasses. Sometimes I like to use the zoom emitter with the lens cap where I apply it directly to the body. Sometimes I like to use it just with the cage here. Just a moment ago it made a beeping sound and it changed from continuous wave to pulse wave. It's a nice thing about the built-in protocols. It does a combination. Every protocol does a combination of continuous wave and then pulse through a variety. And it just made another beeping sound. That just changed the hertz frequency to the next level. There's 5 different levels of hertz frequencies. We're working on the lumbar spine. We want to address the vertebrae and the erector muscles on the side of the vertebrae. When those are tight and contracted, they pull the vertebrae out of alignment. Just changed again to another hertz frequency. You'll notice I keep the emitter moving. Not too fast, not too slow. Just enough so that not too much heat builds up on any one area. How's that feeling as far as heat-wise, Sarah?
It feels great.
Do you feel the warmth?
Yes.
Excellent. So the beauty, there's another hertz frequency. The beauty of the photobiomodulation with the class 4 laser is we are delivering more photons deeper to target tissue on multiple different wavelengths than any other technology out there. As those photons are absorbed by the different target tissues, we're getting a natural production of ATP or adenosine triphosphate into those cells. The mitochondria is converting photonic energy into ATP, which is an instantly, readily usable form of energy for those cells. The laser serves as a natural muscle relaxant, and that just clocked out. All that means is that it's no longer live. The emitter, we can now we can choose a different protocol. For example, we can go to the therapy mode. We can choose shoulder. We click next. We choose the body size, medium, darker skin, medium chronicity. Click treat. Click standby. Says it's ready. It's going to produce 16.7 watts of energy. We've got our glasses on. We're going to push the yellow button right here. Now it's live. Now, if Sarah was turning in the other direction, we'd be working into her rotator cuff. This is so good for rotator cuff. Knocks down the inflammation, relaxes the contraction, increases the blood circulation, and improves the level of energy in the cells. You can also work in the cervical area. Along the trapezius. We get into the scapula. And if you're the kind of person that is into Oriental medicine and meridians and acupuncture points, you can trace along the meridians of the body. Fantastic for carpal tunnel syndrome. If you've ever heard of Korean hand acupuncture, you can trace the meridians on the hand. Each finger, around the perimeters of the finger, are the meridians. This just opens up the energy pathways, gets the energy and the chi flowing. Anybody with tennis elbow or golfer's elbow, nothing compares with the class 4 laser therapy for repetitive strain disorders. Bodybuilders, athletes, everyone can benefit from class 4 laser therapy. Some people say just focus on 1 or 2 areas. And as a general rule, that's a good practice. But another form of therapy is to actually utilize the laser on multiple areas of the body just as a form of opening the energy, increasing the blood flow, increasing the movement of energy through the meridian systems as a general tonic, improve the constitution. So there's different ways, there's so many different ways of applying laser therapy to the body. That concludes our demonstration on Sarah's backside. Now I'm going to set a new protocol for Sarah's knee. We've got the therapy button chosen. Click knee. Click next. Click medium-sized body. Darker skin. We're going to say that it's acute. And click treat. It's on standby mode. Instead of using the cage emitter, I'm going to unscrew that. And I'm going to put the rollerball emitter. It's actually the cylinder that needs to come off. Once that's off, there's another similar cylinder already attached to the roller ball. When we push the standby, the red light will become active. It says ready. It's completed its sound. It lets you know that it's fired up. It's set up to do an average power of 13.4 watts. Peak power of 13.4 watts. It's got a distribution of that power throughout the 4 different wavelengths. It's set to do continuous wave and then pulsed. It's going to pulse at different intervals through these 5 different stages here at the top. When we push the yellow button, we start to hear the sound. We know that it's live. I personally like how the roller ball glides around on the body very easily, and I like how we can massage into the muscles. How's the comfort level for the heat coming out of this, Sarah?
Good.
So as with the standard cage emitter, we do need to keep it moving slowly and steadily, never remaining in one spot for too long so that too much heat doesn't build up. But that heat lets the patient know that something's happening, that this device is on, that it's working, and it's working incredibly well as it delivers a large dose of photonic energy to the target tissue on multiple different levels. And that protocol is set about 3 minutes. We've already got through 1.5 minutes. You can see it's very quick, very easy to complete a protocol for one small part of the body. Sometimes when people have knee problems, it's not always necessarily just because of the knee. They could have something going on in their ankle, something going on in their foot, even something going on in their hip or their lower back. And there's all types of different things that can cause knee issues, but relieving the pain and the inflammation in the knee and also finding out where the issues are on other parts of the body can be helpful to resolve the issue for your patients. So there you have it. The Remy Quad 4 wavelength class 4 laser. All the different 25 different protocols. Your ability to be able to put in custom protocols. Your ability to use multiple hand pieces. It's portable. It's intuitive, it's easy to use, and it's extremely effective. So now that you know how the Remy works, and you know that it is one of the greatest delivery systems for photons to the human body quickly and deeply and effectively, let's take a look at the fact that the human body has over 70 trillion cells, and every cell in the body needs energy. And anytime there is sickness or disease in the body, those particular cells that are injured need energy. How are we going to get the energy to those cells, to that target tissue? The Remy laser is the perfect solution. It delivers deeply and effectively to bring the photons to those cells, which are then converted by the mitochondria inside of the cell into adenosine triphosphate, or ATP. It upregulates the metabolism of the cells and sets the healing into motion. At the same time, different wavelengths like the 980 nanometer wavelength have a cascading effect of anti-inflammatory effects, deactivating 7 of the 9 enzymes that cause inflammation by up to 70%, thereby creating a more favorable inner terrain for healing to take place. So the combination of different wavelengths works synergistically with the human body to allow the greatest healing to take place. We've got the 980 that we just discussed, pain relief and anti-inflammatory, the 905 nanometer wavelength for NO, nitrous oxide production, vasodilation, increased blood circulation, especially to the extremities. And we have the 810 nanometer wavelength, which is extremely beneficial for eliciting photobiomodulation, or PBM for short, in the body. PBM is the optimal method of delivering energy to deep target tissue to elicit a long-term healing effect, and fantastic for rehabilitation. And then we've got the 650 nanometer wavelength, which is a red wavelength, whereas all the other wavelengths are infrared. 650 red nanometer wavelength at 200 milliwatts in the quad is beneficial for all the soft tissue issues. It's fantastic for healing wounds and skin issues and burns, and boosting the immune system and reducing inflammation. All right, see you in the next one.